Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast, where all healthcare items are discussed.
All of them.
Wow.
All of them. All of them.
No, there was so much pressure right now to get this done because Lauren has a lunch.
This is also the experimental phase. This is my jazz phase podcast script, so we don't know how this is going to go either.
The script today, dear leaders, is slight.
It's a little slight.
We will do our best.
Yes, that was part of it. That was in my script.
That's Jamie's
That's
contribution.
Jamie is very upset.
And Jamie's script was
It was chunky.
Chock full.
Yeah.
Robust. That's what it says at the end of his script. It says, that was a robust conversation.
Yeah. Campbell chunky soup versus a bisque, which I have.
It's more like a broth.
It's a broth.
It's more of a broth. Yeah, I've been saying.
Because
It's still got nutrients like bone broth. Yeah.
But, yeah.
Lauren is giving us room to grow.
Yes.
I think that's how I describe this script.
I like that.
Yes. So thank you for the trust you have in all of us.
Yeah, because you would always add more stuff to broth. It's just the base.
That's how you make chicken noodle soup.
Exactly. You got to start with a good broth. Yep.
Chicken and some noodles and okay. Well,
This is going well.
yeah. We're and at least we got the time this thing. So good. And all right, we are.
Sorry, Sharon.
Let's for Sharon. Right, she said, "Don't do this."
Don't do this.
Well, anyway, that is what it is. So let's introduce ourselves, and we'll start to the right this time.
Oh, it's me. It's Lauren, the Director of Government Relations at AMGA. Hello.
In her jazz phase.
In my jazz phase.
Alicia Sawyer, Government Relations Assistant.
Jamie Miller, Ambassador of Goodwill here at AMGA.
That's the most you'll say at this podcast. All right, I'm Chet
What's not allowed to say, yes.
Yeah, that's right. I'm Chet Speed, your host. The question of the day, also provided by Miss Latney, but a good one, a very good one. When was dueling officially ended in the United States of America?
So the answer that I found out yesterday, if you just have time, go and watch the Homeland Security nomination hearing for Markwayne Mullin, because this was brought up.
Seriously?
Brought up by Rand Paul.
Of course, Kentuckian.
Yeah, Kentuckian.
I'll get to that.
Rand Paul decided to be deliciously petty and use his opening statements, 4 minutes and 30 seconds, to talk about how he got beat up by a neighbor, and then Markwayne Mullin celebrated that. And then he asked for him
pneumonia, like a punctured
pneumonia. It was a lot.
And it was all over a long dispute.
Long dispute. He was very sick. And Markwayne Mullin's like, yeah, I kind of understand why they did that. And then so Rand Paul gave him an opportunity to retract that. Markwayne Mullin did not.
Did we think he would?
He did.
No.
And so the
He's
question.
an MMA fighter.
Yeah, he's an MMA fighter. And he's like, I thought we talked about this privately. It was very much like, I'm not going to give you this. And then so Rand Paul asked, he was like, well, how long has it been since dueling has been banned? And Markwayne Mullin did not know the answer, because I guess he's like, bring back dueling. And he's like, it's 170 years.
Bring back dueling? Oh my gosh. What a base.
But let me tell you why he may know. So when I got sworn in to be a Kentucky lawyer in front of the Bar Association, we have to swear to two things. One, uphold the Constitution, and two, not to duel.
The best.
So to be a Kentucky lawyer, you got to pledge you will not duel. And the reason why is because all those folks from Tennessee would cross the border and duel in Kentucky. So Kentucky is very anti-dueling.
Well, he's a Kentucky doctor. Do you think they make the doctors swear not to duel too?
Oh, I would hope so.
Oh, that's a good question. Well, just the lawyers, because we're so cool.
So it was 170 years ago. So they're dueling with muskets, I assume, not swords.
Yeah, well, I guess he was
Pistols?
talking about. So who was the
Musket
South
pistol.
Carolinian who got beat up on the floor, caned?
Yeah.
South Carolina.
Sumner. I think it was
Sumner
Sumner.
got beat up by, right.
Yeah. And I guess the reason why the people...
But that wasn't
the
a
other
duel, that was
members-
just an assault.
That was just an assault.
Yeah.
The other members did not help him because one of his friends was holding a gun, pointed at them and don't intercede.
And then everybody was trying. This is I think it was the 1800s, maybe.
No, it was 18, well, it was 1859.
Yeah.
Okay. And they were talking about trying to, he was worried that he was going to get voted out of office, and all of his constituents sent him canes to his office.
Oh, that's right. And so Mark
We learned that in
Rubin-
South Carolina history in the 8th grade.
Yeah. So we have Kentucky history. We have South Carolina history. It was a very rich conversation. We did not get an apology, though, at all.
Oh, yes. Right,
Yeah.
right.
And Rand Paul was like, I'm not voting for this man.
I did. Yeah, I saw the write-ups. So right now our members are like, are we going to talk about healthcare, or are we just going to talk about
Well, we
dueling
have
and-
dueling arguments about what happened at this hearing of why healthcare
well
prices are as
done.
hard as they
Well
are,
done.
high as they are.
I think we should try and say dueling as much as possible.
Yes.
No?
Okay. I won't even ask the question because you're on top of it.
Yeah.
So, Lauren, there was a third hearing on affordability.
Yes,
where
there was
these dueling
policy
positions
priorities
were mentioned.
were
So-
brought up a lot between Republicans and Democrats in the committee. So as you said, this is the third hearing that Energy and Commerce has done. Ways and Means have also done 2 hearings about this. They have not talked to providers yet. The title of it was called Lowering Healthcare Costs for All Americans, an examination of the U.S. provider landscape. And so they wanted to explore, why is healthcare so expensive? And doctors, why is it your fault? In hospitals, why is it your fault? I think one of the most interesting things is that one of the comments that became at the beginning of the hearing was from the Health Subcommittee co-chair Guthrie, who talked about how Kentuckian. There you go. Who talked about how his wife had a minor healthcare emergency. She was in the ER for over 6 or 7 hours, and apparently it was not billed correctly, and they sent it to bill collectors, which ruined her credit.
Oh.
He also talked about that he pays $1,500 a month in healthcare insurance for him and his wife. He's like, members of Congress do not get healthcare for free. That's
$1,500.
$1,500. And so he talked a lot about how unaffordable and how problematic the system is on all levels. And then was like, so doctors, why is this your fault? So I think it started out with a really interesting point of here's someone saying a very traumatic thing that they're still going through, but still kind of not getting the point that there are so many other facets that need to be helped in order to reduce healthcare costs. Mm-hmm. And one of the things that he has proposed, which is not a really, which we will see impacted, is let's cut Medicaid and Medicare.
Right.
And it's also let's not renew the ACA tax credits. So when you talk about dueling positions, I think that story really sort of put a lot of clarity on how some Republicans are thinking about this issue.
And I will say about Guthrie, he's a Kentuckian, but he's very, very, well, everybody in that state's very bright, but he went to West Point. So it's like he comes with this Southern accent, but he gets into the weeds. And I've never met anybody from West Point that wasn't really impressive. So
yeah, it was an interesting story, and I had a lot of empathy for him. I was texting with a staffer about it while in. She's like, "Are you hearing this?" I was like, "Yeah," and then it's like, "So what's going to be the solution here?"
The solutions are hard to find.
Solutions are hard to find, but we have some solutions. Which, we do.
We do.
Yeah.
Now we have this open-ended script. Are we going to get to that later?
We're going to get to that. We're going to get to that a little
Okay.
bit. Yes.
I need to get to page 2. Very good.
that'll be part of my script. Yes, we do.
No, I think we do.
Yeah.
And this is
You think?
Crackerjack staff here.
yeah, that's the best and the brightest right here. There's a lot of issues that go into healthcare costs, and the solutions are multifaceted.
Multifaceted.
And I do believe we have them.
Yeah, we do.
So I'm pretty excited about that.
Yeah.
And this is to go back take one step back. This is a critical issue for the members because affordability is the political watchword for both parties right now. And I think Congress is looking at the industry, healthcare that is, with a healthy dose of skepticism, whether it's payers, providers, or pharma. Yeah. And right now we're in the crosshairs. So how we address that, how the members address that, and how we help the members address that is going to be one of the big things we do for this year and in 27.
Yeah.
So look forward to a very, as Alicia said last week, robust discussion around this, despite the lack of a script.
Yeah.
Okay. So,
I'm smiling.
somewhere Daryl's smiling.
Daryl's smiling.
Daryl's happy.
I think we have a strong start.
Oh, this starts great.
Yeah.
We'll
see how the middle goes.
So do we land? We'll see.
Yeah.
No, good point.
Yeah, we're just scatting.
Yes.
Okay.
Go back to the jazz reference.
Yes.
I've been thinking about that one.
All right.
Yeah.
So let's talk about the elephant in the room when it comes to affordability. What is that elephant?
During the One Big Beautiful Bill Act that was signed into law last year, I think there was a One Big Bad actor bill that there were a lot of plays by the Democrats on OB3. There was almost $1 trillion cut from the Medicaid system. Not to mention the fact that there is a 2.5% efficiency adjustment that was in the fee schedule, and you're also looking at cuts to Medicare. You're seeing Republicans, they talk a lot about we invested in rural health care with the Rural Health Care Transformation Fund. But overall, there's going to be a big hit coming to our healthcare system, not too far from the time we're talking now. And so there is a little bit of concern about what that looks like. And then you have providers and hospitals who testified that said, well, there are other things in place too.
Okay, fair enough. All right, let's talk about the hearing itself. So let's talk about what the witnesses talked about.
So a major theme in the hearing, the providers, or the witness saying, the providers are facing a significant financial pressure, labor shortages, rising wages, supply costs, lack of proper reimbursement from providers, from public and private payers. And if you probably recall, there was a pandemic, which put a huge strain on the healthcare system. The committee leaders also admitted that hospitals, physicians, and other health professionals play an important role for the delivery of care.
Yeah.
So yes, we agree with that. And they also indicated the goal of the hearing is to explore how these provider incentives and trends in the healthcare system shape patient affordability. And we've talked about this in past podcasts, but and CMS as well. They care about the patient and the patient's ability to get access to care, which is great because that's what AMGA cares about as well.
All right, fair enough. So that does tie into one of our biggest concerns.
Yeah, that the physician payment is not keeping up with the pace of inflation or practice costs, and there is no way to recoup that cost in any way. So you have to really rely on the largesse of the federal government to help fill those gaps. One of the things that was consistent about across most of the witnesses who testified is that there needs to be an inflationary adjustment. Yeah. And there needs to be a greater look at that, and Congress should really take that take that very seriously, and they haven't so far.
Yeah. Oh, sorry. I'm sorry, Alicia.
No, I wanted to get. I have one line here.
Oh, okay.
I have a sentence to be said that is given.
Our
to
trumpet
me.
is coming in from the desk. Yes.
Yeah. So witnesses talked about how right now many medical groups are being asked to manage risk, coordinate care, invest in infrastructure, while reimbursement remains flat or declines in real time, and that's just no way to plan.
Yeah, and it is amazing. We think about, so Part A is sort of keeps up inflation just a wee bit. Part B is actually well below inflation. And now you have Medicare Advantage, which has a 0.97% increase this year. So we're getting hit on sides A, B, C, and part D of Medicare. And then you have $1 trillion with Medicaid cuts. So, I mean, yes, there are pressures all over right now. And then the perception issue of healthcare providers as being part of the affordability problem.
Yeah.
So there's plenty of headwinds along us right now. Okay, so what are we clear about when we talk to Congress?
That we need long-term Medicare payment reform. We have our wonderful MACRA task force that put together a whole playbook, a whole book of recommendations that cost money and some do not, of regulatory and legislative fixes in order to address these problems. One of them is something like I mentioned before that most of the witnesses talked about, which is annual updates tied to inflation. There needs to be more predictability. And for physician practices, if you're going to be in one of these models, don't switch everything in the middle of a model, which makes it almost impossible for providers to actually continue the model, and then align it more with value-based payments, something we've talked about a lot. And also just we need investment. Investment is important. If you're wanting people to be in these mandatory programs, you want people to shift to value-based care. If you want to expand that, you have to put money in place. You cannot just assume that people can take on that kind of cost when the investment is so high.
Agreed. Jamie, what are your thoughts?
Yeah, I mean, Lauren kind of hit on already, but AMJ's perspective is something that is appreciated and shared with a lot of the witnesses of the committee who represent providers and provider organizations. So we are definitely being heard on the Hill because the witnesses who are testifying are repeating a lot of these arguments.
Yeah, the focus is often on prices without enough attention to the underlying payment system that shapes provider behavior.
That is an outstanding sentence.
Thank you.
You're welcome.
Wait. You also have a good one.
You have a good one.
Thank you. So we're talking about symptoms, not root causes.
Correct.
Thank you.
There it is.
Good
Nailed it.
delivery. Yeah.
Doing it.
I contributed.
You did.
Thank you. That's senior leadership right
That's
there.
it. That's it.
Oh.
Yeah, next line. Line.
I had 2 in a row.
Yeah. Yeah.
That's also senior leadership.
Yes.
Missing the obvious. Okay. All right. Well, let's shoot to something AMGA members care about deeply, which is data.
Yeah. This is one of those things, I'm going to jump ahead of Jamie real quick, that we saw across
This is
all.
your script,
It's
so.
my script.
Yeah.
We saw across all 3 hearings is like when the insurance companies were blaming us in the first hearing, they were like, well, we should share data. We should share claims data. And that would help reduce costs. And that is something that we've been talking about a lot. Okay, Jamie, I'm
For a
sorry.
long time.
I interrupted you.
No, that's fine. No, that's you bring a good point because I thought about when I was at that meeting with Dr. Oz and he talked about prior authorization and how providers are not sharing data, and we're like, huh, what? So yeah, there's definitely a disconnect between all the different stakeholders. But yeah, data. This is huge.
Huge. Yes.
You can't manage. She didn't put that in the script. She did say huge though. You can't manage cost or quality without timely, accurate data. And I would say the devil's in the details. In this case, many solutions and much potential for reform lay in the data. So AMGA continues to advocate for more safe sharing of data that leads to better integration.
Yeah, we're seeing that the Biden administration did a lot of things in place while they were in terms of next year. Everyone but commercial payers will start sharing their claims data with providers. So it's a solid start. We want commercial data as well, but I think it's a good foundation for us to talk about once we see these things sort of implemented, like making sure we're staying on top of, are you sending letters? What is the clarification that we need? What we need more than this? And so if they're all talking about claims data, we're here, girl. We got you. We can give you everything you need.
We're sat.
We're sad. Yeah.
We're sad.
Yeah, it's like when you agree with something or you like something, you're like, I'm sat, like I'm listening. I'm sat.
You have to do that with your hands?
Yeah, you do. You have to do the hand motion, otherwise it's 50% less effective.
That's why we're gonna have video soon.
Yeah,
So-
I'm preparing.
Yes. I saw the like drain a little bit from Chad's face. You're like,
Okay.
how can you implement that? That's the challenge.
Well, before I heard about SAT, I was going to say let's take some credit for the CMS move on claims data because we've been pushing that for 10 years.
10 years.
We talked to, actually, Lauren, I believe before COVID, you got legislative language
Yes.
that required commercial payers at the time to provide all claims data to providers and patients through an API, which is SAT. I don't even know what that means.
Passed out twice in Senate Health Committee. And who led the charge the last time?
Mark
Wayne Mullin.
I love it when everything comes full circle.
That's why you brought it up.
That's why I brought it up. I did not think about that. But yes.
But when you surprise yourself, wow, that was pretty good.
Good.
But in truth, using that success with the Health Committee and Senator Mullin, we did talk to CMS over and over and over about the need for Medicare to change claims data. So let's take a little credit where credit is due. I think we helped CMS come to the conclusion that sharing claims data is good for the patient as well as the cost. So well done there. Congratulations. Skibbity, I know Skibbity's out, but that's all I know. Okay. All right. So let's talk transparency a little bit.
Yeah,
Also came up, I believe.
Oh yeah, and I think a lot of providers talks about price transparency. Like it's not enough in its own. Like posting prices that doesn't actually lower the cost of providers and patients can't act on the information. Consumers aren't really shopping for prices, especially in medical emergency. But I will say that I know that all of us here are pretty well versed in healthcare and prices, but I can tell you that looking at my EOB and all the different things with health insurance, I don't always know. Or when you're trying to figure out what health insurance you're going to get next year, you have no idea. And I mean, Chet's probably the most well versed in this. Like you have no idea how to choose things. So I think we need to educate. I didn't mean that as an insult.
Yeah,
I meant that Chet. We all are trying to change insurance constantly for our parents and for our children. And we just need better education, I think, in the system. People being educated about how healthcare dollars are spent. So.
Agreed. It is an opaque system. Okay, value-based care. Ms. Latney?
Yes. We continue to emphasize, as we did in our market value playbook. And also, this is one of our bread and butter, is that value-based care aligns incentives and around outcomes and total cost of care, not just individual prices. And so I think it's really interesting, like individual prices were brought up over and over again. I think this is particularly for small companies who are trying to run their own plans or self-insured. But we are seeing if you do lump payments, then your provider is in charge of your total cost of care. And with that, we're seeing reduced hospitalizations. Most importantly, better chronic disease management. There was a lot of conversations around primary care and the need to manage chronic disease as people are getting older. We're seeing more chronic diseases and also lowering overall spending.
Which is what policymakers want.
They say.
Yeah. And what's interesting is when you think about value, you need the infrastructure to do value, and AMGA members have that infrastructure.
Yeah.
So they actually do it best. And one of the messages we will have up on the Hill going forward is to lower cost, you need to manage chronic conditions. The people that can do that are AMGA members because they have all the infrastructure and the people in place to do just that.
And we have legislation around that too.
Yeah, yes, we do. So we're, I think we're on top of things.
Yeah.
So that's good. Okay, so what are the biggest risks to our members coming out of these hearings?
Always overly broad payment cuts that don't differentiate between high value and low value care. It seems like there's a little bit of sentiment. It's like if you cut, people will adjust. And there is a point where the adjustments come at the cost of patients having quality care. Because if you're having to shut down or get rid of admin staff, if you're having to shut down certain non-profitable or things that take a lot of money in your ERs and things like that, you're just going to have more congestion in other places in the healthcare system. So broad cuts, we're going to see this when we release our Medicaid survey of what people are kind of anticipating for next year. Will show just that this is not going to be a sustainable system. We've heard that from the witness panel. It's something that we've stressed on the Hill over and over again, and something that our members have stressed as well.
And there's a definite sentiment in Congress anti-consolidation. And what that means is there's a lot of policies being floated out there just they're going to discourage integration, which could be bad for outcomes, could be bad for our patients. And I think what was not really being discussed is why is there integration? Why is there more cooperation? I mean, you could talk about spreading risk is really important. So you need more members of your ACO and other things. But as Lauren just mentioned, declining reimbursement, that's happening. So how do you react to that? And we've talked about this in the past, there's a lot of regulations and quality reporting and things that are leading our members having to hire people to do non-clinical time and hours and things like that take away from medicine.
Yeah, and the third risk is we're seeing a failure to invest in the infrastructure needed for value-based care. That includes data, workforce, and care coordination. You're also kind of hearing this view that the physician workforce shortage is being used to raise prices.
Okay. All right. We are at 21 minutes, so why don't we go right to final thoughts?
Yeah.
And I think, so what should an AMG member be doing right now to address, like I said, the headwinds they have, whether it's reimbursement, whether it's perception in Congress about how they're contributing affordability, what should they be doing as we speak?
You can't shy away from engagement. Okay. You have to be able to tell your story. You have to be able to share, here's what we have done in order to reduce costs, but also here are the things that we need if we want to improve patient quality access, which ultimately what it boils down to is you can't, if you not only can you not afford it, but like if you can't even access it, then what are we all doing here? So we need and really would like you to share your stories with us, whether it's participating in any of the programs that we have in place for grassroots, but you've got to engage.
And I would just say sharing, like, are your patients happy? Are there programs you've done to put your patients in the right setting to get the right care at the right time? Congress loves those kind of stories.
Yeah, Lauren mentioned getting engaged and telling your story in our grassroots programs, and we make it so easy for you to do it. All you have to do is tell your story, and we do everything else in our DAP program. And if you attend Capitol Hill Day, June 10th, we do it all. We facilitate everything. All you have to do is show up.
Agreed. So it really does come down to engagement. I think all of you, the three of you, do a great job on Capitol Hill, representing the interests of AMGA members. But when we partner with you and have you in that room, I think it's even a stronger voice because they do need to hear exactly what you're all doing back home in their communities. Okay, I think that's it. We started with dueling in Kentucky and Oklahoma.
Do they have dueling in Nevada is another thing, because we'll be in Vegas next month.
Feels like they might.
Very nice segue. Wow, that was good, because I had to add that. Yeah, so, and to our listeners, this is our last podcast until after the annual conference. We do hope you'll be at the AC with us in Las Vegas. And with that, the team will
please
say,
come and please find us if you recognize our
yeah,
voices.
that's right. Please come.
Happy to sign autographs. It's not a problem at all.
I think Miss Latney and Mr. Drebner will definitely be signing autographs. And
And we'll
I'll have
sing the
Chardonnay
jingle
if
if you
anybody
ask.
wants a Chardonnay.
the three of us will just watch.
Yep.
All right.
And Lauren will give you tea if you want tea.
Yeah,
She
yeah.
knows how to find the good teas.
Yeah.
Don't
I
tell
haven't
them where it
stolen
all-
them all.
Yeah, don't tell them where it all is.
I think labor union in Vegas will stop you.
Any good lobbyist. Yeah, right. That's true.
Vegas is a union.
It's
It's
certainly
a union
is.
town, so don't be. Yeah.
So be swayed.
And don't be moving furniture. You're gonna get in trouble.
You know, indeed. All right. Well, thank you all. It's been a great winter, great spring. Thanks for all the hard work, representing members. And we will see you all in Vegas. Have a good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.